Hello, I'm Ryan Kalpinski, and I'm a health psychologist in the United States Air Force. And today, I'd like to talk through a story with you, but the story isn't done yet. Today, let's talk a little bit about how people are handling this pandemic. And we, as human beings, have all sorts of different responses to stressors. And when we think about stress, oftentimes people assume stress is bad and that you should get rid of stress. But the elephant in the room is that the stressor, COVID-19 in this case, isn't going away and it's inevitable. So when we think about how it is that we should respond to that, there's actually quite a bit of intentionality that you can put into how you respond as an individual. And so let's get into it. When we think about the stressor at hand, it's invisible. It's a virus and you can't see it. You don't know if it's on a door handle or in the grocery store or lurking in your own home. And many times people are carrying it without even knowing that they're carrying it. They're asymptomatic. And that can be pretty terrifying for a lot of different reasons. And at the same time, it's still just a virus. It's something that we have a lot of information about. And there are leading experts focused on how it is that we can best manage this stressor, this kind of invisible threat in our environment. And so to respond in the same way as you would respond when, let's say, this guy's chasing you, well, it's not the same thing. To respond when a bear is chasing you, your amygdala, this part of your brain that kicks off the fight or flight response, it kicks into high gear and all sorts of things happen to help you to run faster or perhaps, if needed, fight stronger if this bear catches you. But COVID-19 is not a bear that can catch you. It's a virus that you could potentially pick up from a surface or an airborne particle. And that is not the same thing at all. So if your amygdala is kicking off left and right, day after day, over the course of months, that can really tax the system. And the system that we're talking about is parasympathetic and sympathetic system. Sympathetic system is that stressor system that helps you to run from and fight a bear. But COVID-19 isn't something that you can run from or fight. It is something that you simply prepare for. And those preparations are very clear. Wash your hands, wash them regularly. Wear a face mask, especially in public places, to protect both yourself and others from airborne particles. And, in some cases, wearing more specific medical equipment like gloves or N95 masks might be indicated, especially if someone is actually infected with the virus. So as we think about these recommendations, they're super clear. And for all intents and purposes, these recommendations should help you stay free from this stressor. Now, that doesn't always feel as comfortable as people might imagine. So thinking about how this long-term psychological stressor plays out is it's a little different than maybe physical stressors. So let's think about how psychological versus physical affects our system. So astronauts, pretty physically fit people as they go into their missions in space. As they then live for maybe months at a time in a weightless or low gravity environment, there is less stress on their physical system. So gravity is a stressor on our system. And when they return from that low gravity environment, their system, muscles, bones, they atrophy, bone density decreases. And so simply stepping off the shuttle can be dangerous because you can end up breaking a bone. And so as we think about how physical stressors such as gravity, exercise, how those help our system to maintain strength, the same is true of psychological stressors. In fact, the more and more you face challenges, stressors, the more capable you are at facing them. So just avoiding stress is not necessarily the thing that we ought to do right now if we really want to thrive. So let's talk through a quick study. 30,000 people were asked 2 questions. The first question, how much stress have you experienced in the past year? And that can be low, moderate, or high. Think about the answer for yourself. They were then asked, is stress harmful to your health? And simple yes or no. So then they looked at these 30,000 people over the next 8 years, and they studied death records. So what they wanted to know was how people think about stress. How much does that impact people's likelihood of passing away? So when we think about how people viewed these questions, it's really clear. The people with high amount of stress in the past year, plus thinking stress is harmful to their health, they were 43% more likely to pass away. Well, that's not good. It's kind of bad news. But the interesting twist, the better news, is that for the people who had the highest amount of stress and thought that stress was not harmful to their health, meaning they thought stress is kind of good for them in a lot of ways, they're actually the least likely to die of all groups. So this is something that you can actually choose to think differently about. This is called having a flexible mindset, or thinking that you have more control than not. And so as we think about this current pandemic and kind of where things are headed, there's a ton of uncertainty, but how you think about it matters most. So as we face this, what we call social distancing, but I like to think about it as physical distancing and social connectedness. As we think about physical distancing, how can you remain the most connected? How can you grow and strengthen your bonds with others? Technology is a wondrous capability these days as compared to past pandemics, so we have a real advantage to actually rewrite our story a little bit differently. And so what we know about performance, both on the job and in life, things like optimism, social support, and mindset, such as the one that you're facing challenges rather than threats, more flexible versus fixed mindset, those are really predictive of performance, high performance and success long term. Simply being smart or having basic capabilities isn't what predicts performance. It's really having a high optimistic outlook, focusing on what you can do rather than the things that you can't do right now, or things that might be limited. Focusing on those things you can do is really key to having your best performance during this pandemic and beyond. So as we think about how COVID-19 is affecting each and every one of us, we can pull together to really face this challenge. As a society, we can think differently about how we treat each other and how we handle the stressor at hand. And facing this challenge is, it's honestly a long-term game. So as we think through this, let's write our story together. How is it that you want to talk about the way that you acted during the pandemic? Do you want to be the person that maybe stayed at home and did little to nothing different to influence the people around them or society? Or were you a person who made face masks and donated them to healthcare workers or people who can't afford them? Or did you maybe grow your bonds and strengthen your connections with your family, maybe even better than they were before the pandemic? And perhaps you're somebody who volunteers online to mentor youngsters who are, affected by the social distancing recommendations. So what is it that you're going to say after all this is behind us and we have a handle on fighting this virus? What is it that you can say about how you managed your response to the COVID-19 pandemic? That's up to you. Be well, stay safe, physically distant, and socially connected. Take care.